This video is going to be looking at a couple of components. If you have dizziness, or vestibular issues, that may also have a cervical or cervicogenic component, so coming from this upper cervical spine. So we're going to combine eye movement, head turning, and then also this dynamic of the upper cervical spine, which is when you rotate one way, you want to try to emphasize a little bit of a side bend in the opposite direction, almost as if you're trying to crack your own neck. So it's just a little gentle, but kind of guide it, and you're always stretching tall, always trying to lengthen and decompress. You don't want to compress too much, pinch or grind in there, especially if it's painful. You want to try to do this without pain. So your hands are going to be your targets. So we're going to start by doing this kind of curl, the shift lift, and kind of curling my palm up, and my palm is going to be what I'm looking at. So I'm going to look up here, and again I'm rotating my head to the right, so I'm going side bend to the left. I may be able to use my opposite hand to kind of guide that, to kind of create that hinge, and then I can go the other way. And you want to focus your eyes, get your gaze on the palm, so you get eye focus, and you can go faster as you can tolerate without dizziness. You can also progress this by doing this standing on an unsteady surface, like a high density foam cushion or pad, pillow, whatever. As long as you can keep your balance and it's safe, you're not going to fall, or have something sturdy nearby that you grab a hold of if you do start to lose your balance. Okay. And then to make it even more challenging, with or without that additional padding, would be to actually look in the opposite direction, in which case you're going to want to do like this. And so I'm looking away from my target hand, and that's a little bit of coordination. Okay. The other thing is like reaching across your body and look at your hand. So you're shifting across and turning across, and that can be a little challenging too, especially as you do this faster, because your brain has to crisscross. It's like a mirror image. It has to be able to, if you're doing something in the mirror, reverse it in your head. So it's just a way to challenge all those components of the neck, the vestibular, the inner ear, and movement to be processed within the brain. So hopefully that can help to sort some things out. But at the very least, with the neck, getting that articulation in there so that things get unstuck, unjammed, and that also can clear those pathways so that things can be processed better, because it's a more accurate representation of what's going on instead of being distorted or off in some way.